I want to discuss some of the diagnosis methods that we've got, diagnostic methods for making this diagnosis both in the community and at home. Somebody with diarrhea, outside the hospital, inside the hospital, different kettle of fish, I suspect. What are the potential causes of diarrhea?
There's a few dozen potential causes of diarrhea that we have to think through. So as Dale said, C. diff is the most common nosocomial infection, but still a minority of patients with diarrhea, even in the hospital, are C. diff positive, or the diarrhea is due to C. diff.
Okay.
So many other things, medications being very common, other infections, tube feeding, other GI disorders, other causes of colitis, et cetera, malabsorption, a long list.
So diarrhea is not C. diff till proven otherwise.
Correct.
Diarrhea is a spectrum, if I hear you correctly, of which C. diff is one. Now that's in the hospital. What about outpatient? Is it the same? Is it more common, less common? What do you think?
It's probably less common if you control for things like age and comorbidities. But an older person with comorbidities and antibiotic exposure would be at risk in the hospital or the community. But the interesting thing is when you look at community-acquired C. diff, many of those patients have not had recent hospitalization, have not had antibiotic exposure. So it's present in the community, it has to be thought of, but it's less common than in a hospitalized patient.
I mean, pity the poor primary care physician. Here's somebody coming to that person and says, I've never had it, well, I haven't had antibiotics in years. I've never had a diarrheal illness. No one in my family has had a diarrheal illness. Nobody that I know is in the hospital has diarrhea, and yet you're telling me it could still be C. diff. Why?
We don't know.
Well, there's a refreshing answer.
Yeah.
You know, we don't know.
So one of the things, though, we did a study on community-acquired C. diff at the Mayo Clinic, and 40% of C. diff in our county was community-acquired. But if you think about our county, a large proportion of patients work in the hospital or work in the doctor's office.
Right.
So you probably don't have to be a patient. I'll strike the probably. You don't have to be a patient. You need exposure to a healthcare environment.
What about pediatricians versus adult doctors or primary care that have a practice which covers the waterfront? Kids with diarrhea different than adults with diarrhea?
Absolutely.
How so?
Well, the kids, for one thing, often are colonized with C. diff in the stool, asymptomatically. Infants in particular, the pediatric recommendation now is do not test those infants up to the age of 1 year. And if you're dealing with toddlers in the 1 to 2 year age group, look for other things first and do not test them frequently because you find C. diff, but it does not mean the C. diff and the diarrhea are related.
I've got little kids, and if you tested every time any one of my little kids, I have twins, had diarrhea, I think we'd be in the doctor's office every day with one or the other. So when you're screening patients for C. diff, what are the factors that you have to rule in or rule out before you start? I mean, laxative use, I would assume somebody's on laxative.
Right, and this gets back to Yoav's earlier comment about appropriate testing. And this gets back to the notion of pretest probability. If someone's on laxatives or another medication that is known to cause diarrhea, lactulose, for example, commonly used in the hospital.
It's almost guaranteed to cause diarrhea as a direct effect.
That's how they work.
Yeah.
So you should probably stop that medication and see how they do before you test for C. diff. And this gets into the notion of C. diff carriage, and we don't have good tests to distinguish between carriage and true infection. So you have to do the testing in the appropriate patient.
Now you said 3 unformed stools, is that what you said, in 24 hours?
Well, yeah, I mean, 3 will be the minimum definition. So, and most people with C. diff will actually have a higher frequency. But I think when it comes to who to test, the most important is when you test, you try to answer a question. And the question should be, does the patient have unexplained diarrhea? And if you can explain the diarrhea by taking medications, by getting tube feeds, as Darrell mentioned, by just getting an oral contrast for a CAT scan, which is so common in hospitals that will open up anyone, even the most constipated person. So it has to be unexplained diarrhea, or there needs to be a feature of the diarrhea that makes you specifically suspect it.
Let me get this clear. You're not recommending contrast media as a treatment for constipation. Just put that on the table.
Well, maybe we
you are.
Maybe we should study that. Yeah.